Well, we're coming to you live from the Healthcare Marketing and Physician Strategy Summit right here in the Expo Hall. So don't mind the background noise. And I'm sitting here with my good friend and colleague, Danny Fell. How are you, Danny?
I'm excited to be with you.
I know. Well, you're excited to be here.
I've been looking forward to this for months.
Okay, well, that's great. I'm excited too. So, Danny, before we jump in today to have a good conversation, share with people who you are, what you do.
So I'm Danny Fell.
Yeah.
And I work for an agency called BVK, based in Milwaukee. An agency that's been around for 40 years, works in multiple industries, in particular higher ed, travel and tourism, and I help lead the healthcare practice with a couple of colleagues who are also walking the floor.
That's great. So it's a relatively new role for you.
It is, yeah. I've been there about 2 months.
Oh,
But
wow.
These are guys I've known for a long, long time.
Right.
Like early in my industry career. Yep.
So we're here at this conference. I know we're at the early stages of the conference, but you've already presented.
We have, yeah.
And unfortunately, I wasn't
Which is a
able to
good
go.
feeling.
You were opposite me. I was actually
Yeah.
presenting as
I
well.
hate when that happens.
So, but share a little bit about what you talked about.
So we talked about transforming healthcare from a leadership perspective, and I had Don Stanziano from Geisinger Health System,
Oh, yeah.
which is a former client of mine going way, way back, and Jim Blazer from Hackensack Medical Center, and we were talking about the ways that those two guys, who I think of as healthcare marketing rock stars, how they're transforming their organization, how they're thinking about marketing strategy, and some of the takeaways from the success they've had.
Come on, share with me. I wasn't there. What are some of the takeaways? What are they doing?
You know, one of the things that I really loved was we got into this whole idea of disruptors, and but at the same time, they're partnering with organizations. Good example, Don at Geisinger is partnering with Best Buy and using Best Buy's team to help deliver healthcare services and equipment to people in the community. So it just goes to show you that even though we talk about disruptors and people coming in and taking over parts of healthcare, it's really important for these healthcare organizations to be partnering with the right organizations at the same time.
I think it makes a lot of sense because I will say that when you're looking at, like in the industry, right, that we can't serve all the people all the time. And so when we talk about disruptors and how they're coming into the space, we really think about them as not competitors. We think of them as maybe co-opetitions. Have you heard that term before?
Yeah.
Is that kind of what this is?
I think that's essentially it. You know, somebody asked about primary care, and Jim Blazer, again from New Jersey, Hackensack, made the point that even if they could, which they can't, they would have to recruit something like 400 or 500 primary care physicians to meet the demand that they have in the marketplace.
Yeah.
So that necessitates thinking about things differently. So introducing new ways of connecting primary care to patients, partnering with organizations that have primary care bandwidth. So again, I think we're in a very different era. The big takeaway for me was that these guys are both super optimistic. This is one of the most challenging times in healthcare marketing, but also one of the most exciting times to be leading organizations and leading marketing programs.
Yeah. And what do you do at BVK?
So I help lead the healthcare practice. We are in multiple industries. Higher education, travel and tourism, and healthcare are the three biggest. And we have a large healthcare marketing team. And so I co-lead that with a couple of other folks here at the show.
That's great. Well, and you do understand the industry. I know that from working with you for all these many years. And our industry is facing some incredible challenges right now. Would you agree?
It is. Yeah, I would agree with that.
So,
maybe unprecedented is a word we could use.
Oh my God, there's that word again, unprecedented. But I agree with you. I mean, we came out of the pandemic, which was unprecedented to itself, and now we're facing some really new challenges that are hitting us. Financial challenges, staffing challenges and hiring and et cetera. And competition and disruption in the industry too.
Yeah.
And I think that's one of the things you were talking about today in the session.
Yeah, so I just came from our session. Great to have it over the first day. But we had Don Stanziano from Geisinger Health System, which you know, and Jim Blazer, who leads strategy and marketing at Hackensack in New Jersey. And we were talking about transformation of healthcare marketing and strategy. How do you lead in these unprecedented times?
Right.
How do you think differently? And what are some of the takeaways and successes they've had at their organizations?
And they've done something really interesting. In fact, that they didn't look at the disruptors as being competitors per se in their marketplace. They actually kind of embraced a relationship with them, right?
Yeah, we talked about it in the session. true. They are competitors, and you have to be careful about how you're partnering and who you're partnering with. But as an example, Don at Geisinger, they're partnering with Best Buy to deliver healthcare services and equipment to the homes of people in their community. I think it's a really innovative way of leveraging what an organization like Best Buy is good at, with an organization like Geisinger that just needs more ways to reach out into the community. And so they gave multiple examples of where they're partnering thoughtfully with organizations that maybe we might have seen as competitive or disruptive, or we want to raise the drawbridge. But I think health systems are thinking differently today. Partly because they have to, but also because they see opportunity in new channels and new ways of doing things.
I always think of that, right? Healthcare is such a high holistic thing that affects a community, and health systems play such a critical role in serving that community. When you have people coming into the market, you kind of have to figure out how to work with them, because ultimately what you're doing is you're serving the greater good of driving, improving care in the community, right?
I totally agree. And I think the other thing is, while hospitals and health systems have been around for decades, right, and longer, they haven't necessarily been the sole owner of healthcare and health, right? Yeah. So consumers don't differentiate necessarily that, all of my healthcare needs to be delivered by this organization or this location, right? Consumers are going to go where they want to, where they need to, where they're getting the most value, and that encompasses a lot of different providers. And today it's a diverse roster of organizations. I think hospitals and health systems probably are still the lead in many cases, and should be, but I don't think it's any more of you can get everything in one place necessarily without partnership.
Thanks so much, Danny.
Thank you, Chris. Good to see you.